Okay. Hi, everyone. Thank you for joining our virtual dental shadowers session. We want to remind you that in order to get your hours, you will have to take a short quiz. And as long as you get 3 out of 5, you will earn your hours. The quiz link will be located in our link tree, which is in our Instagram bio. All right, let's get started. We are very fortunate to have Dr. Patel for today's session. I'm handing the mic to you. Feel free to start whenever you want.
Well, I guess, welcome, fellow virtual dental shadowers. My name is Dr. Patel, like Brianna said. I'm currently an AACD resident. Let's go to the next page. So a little bit about me. My name, Satyam Patel. I'm a general dentist with a focus on cosmetic dentistry. I graduated from Marquette University School of Dentistry, which is located in Milwaukee, back in 2017. And like I mentioned previously, I'm currently an AACD resident out in the North Shore suburbs of Illinois. And I also work as a part-time GP at an office in Chicago. So I feel like this question gets asked multiple times, from pre-dents and even some early dental students, some study tips. And I guess I'll just go over what I did that really helped me while studying, because I know studying can be sometimes overwhelming with the amount of information that is thrown at you in dental school. An analogy that they use often is it's like drinking from a fire hydrant. You just try to just get as much as you can. So a couple tips that I would recommend is, take breaks when you need to. Personally, I can't sit for 3, 4, 5 hours just reading. So I used to break it down where it's like I'll read for an hour, then I'll take maybe like a 10-minute break, 15-minute break, do whatever works for you. But I think taking breaks is very important. I think studying with friends was very, very beneficial for me as well, because when there's something you come across that you don't understand, it's always nice to kind of bounce the ideas off of someone and talk it through, and hopefully, between you and your friend or whoever, you're able to kind of figure out what you don't understand. Or maybe pick up on something that you misunderstood, And I think one of the last things I would say is, when you're reading, I feel like some people just read to read, but you really have to read to understand. So rereading it, writing it out is a method that I did. And that greatly benefited me because it helped the material really stick, which you need to know when you're taking the exams. Staying motivated, yeah, this can get tough when you feel like you're burning out sometimes, or when you're taking 8 exams in a week, it can get tough. Or if you come across your first failure, anything, staying motivated can get tough. So it goes back to why you're there in the first place. Remember why you started. Why do you want to be a dentist, or what do you aspire to do as a dentist? Focusing on what interests you and letting that fuel you, right? That kind of goes back to what I'm saying in terms of, dentistry hopefully is an interest of yours if you're pursuing the career, and what do you want to achieve out of the career, right? So use that as your fuel and let it keep pushing you forward, and find ways to decompress, whatever gets your mind off of the stressful times. Do it, whether it's going out with friends, watching movies, going to different restaurants, working out. There's many outlets, so don't burn out early. And I think that helps in kind of pushing people forward. Well, it helped me, because like I said earlier, I'm just not the type of person that just sits there and just go at all times. Sometimes you have to step back, take a breather before getting back and doing the next thing. Choosing specialties. Okay, so in terms of considering a specialty, I did consider a couple. As you can see lower, I considered OMFS, perio, and pros. OMFS and perio because I really do enjoy surgery. I really enjoy the surgical aspect of dentistry. And pros because I just felt like I wanted to be able to do full mouth rehab cases, do them well, and understand the functionality behind everything, make sure that occlusion is tuned in and stuff like that. And I feel like that stuff isn't touched on as much in dental school as I feel like it should be. So those were the 3 that I considered. And why I considered specialties or these specialties is, the questions that I ask myself: can I see myself doing this day in and day out? I definitely could see myself doing surgery all day, every day, because I do enjoy it. And I find it interesting, right? Which is my second question. Is it something that I find interesting? I can never see myself doing endo, day in and day out. Or do I find it interesting? Not at all. If I never had to pick up a file in my life from here on out, I would be fine with that, because endo is not something I enjoy. And you have to look at the future outlook of the specialty, right? You have to kind of go into, what does it look like? What will the future of endo, OS, so on and so forth look like in 5, 10, 15, 20 years, pretty much the life of your career. And luckily for people who are in dentistry, most specialties, they hold up. They don't just go away. Medicine may be a little different, but for dentistry, you kind of need all the specialties, and I don't see them slowing down or going away anytime soon. So that is my take on specialties. And if you guys have any questions at all, I'm more than happy to answer them at the end. So what is a typical day like for me? So since I am an AACD resident, I am currently pursuing learning how to do full mouth rehab, cosmetic dentistry. My day usually consists of do a lot of lab work, mock up and stuff like that. And that's to learn. And I see emergencies. And when I see patients, the most common concerns I see is, unhappy with their smile and looking for options to enhance their smile, which is what you would expect in a, high-end cosmetic office. Emergencies would be patients we've already seen, or trauma cases where they chipped a tooth, or so on and so forth, which I'll kind of go more into in the case presentations that I have. The toughest parts about proposing treatment plans, I would say, is in addition to what I have listed in terms of discussing all the steps that potentially go into recreating balance and harmony in a smile, I think what can be tough is laying out the treatment plan in a way that'll work, right? You're discussing, a patient comes in, they need their full mouth rehab case, right? They may need ortho, perio, OS, and you as a restorative dentist, maybe even endo, multiple specialties, multi-specialty approach. Question is, how do you approach it? How are you going to break it down for the patient so the patient doesn't feel overwhelmed, which can be tough. It's like, okay, you are going to have to see perio and get gum surgery, gum grafting. You'll have to go to ortho, get braces. Maybe you'll include perio ortho together, where you'll do SFOT. Or you'll have to see OS, you'll have to get this taken out, and then they'll have to do this. So what is the order of operations almost? Who are you sending them to first? How are you going about it? And like I said, how are you going to approach it and lay it out for the patient so they're just not scared away? Because when people come in for full mouth rehab cases, I feel like sometimes it's lost on them that it didn't take one night for your whole mouth to break down. It's not going to take one day to put it back together. So that I would say is one of the toughest things, knowing how to properly treatment plan and laying it out for the patient so that it's easy for them to understand. Because some of these cases take 2, 3, 4, 5, 6 years to complete, depending on what is needed. So here's a case that I had, I want to say a month and a half, 2 months ago. Patient came in. The cases that I'm going to be presenting, they're pretty straightforward. And then my last case will be a little bit more complex. But so patient came in, and like I said, typical stuff I see: chipped teeth, broken down restorations, so on and so forth. So chief complaint was broke my tooth while eating. Medical history, nothing contributory, nothing that's going to affect my treatment plan. The challenges that I faced with this case was matching a composite to blend with the surrounding teeth and meeting patient expectations. When you work in high-end cosmetics, right? Patients come in with high expectations. They want dentistry that looks natural. They want dentistry that doesn't look like dentistry. A goal of mine, and something that I've learned from a mentor, is when we do dentistry, we want to do it in a way that when somebody sees you, they see you and be like, wow, you have a beautiful smile, not, hey, who's your dentist? So make it blend into their face and do it in a way where it looks natural as possible. So here's the case. Patient came in, she had composite bonding done, I don't know, years ago. So challenges you face with this is, the shade that you see or the shade that was done, the restorations were done in 5, 10, 15 years ago, however long it may have been, may not be the shade you can still use because, you know, even composite, whatever it may be, whatever sort of material, things kind of pick up stain over time. Or it could be underlying tooth structure that picked up stain, so that the underlying tooth structure is changing the overall appearance of the composite. So patient came in. This case turned out, I'd say, pretty nice. Patient was happy with it. You know, she had this composite done with my mentor, and those are very, very big shoes to fill. So when she came in and she was told that she's going to be seeing me, you know, all she could sing were his praises, and she's like, you know, hey, he has golden hands. Do you have golden hands? I was like, oh geez, you know, pressure's on. Luckily, when all was said and done, she was ecstatic. She loved it. I love the final outcome. I think it blended really nicely. My next case, I'll show you what I was referring to in terms of the challenges you face when you're trying to match old composites. It can get really tricky and difficult when you try to recreate or just choose the same composite that was used, you know, 5, 10, 15 years ago. So second case, you know, fractured my tooth on a tortilla chip, right? Once again, medical history, non-contributory. In my office, we don't do a lot of surgery. In my cosmetic office, we don't do a lot of surgery, or we don't do a lot of specialty work in general. We do, like I said, a lot of rehab in terms of crown, composite, veneers, stuff like that. We do TMJ, TMD issues. So medical history wise, you know, we don't come across too many medically complex patients. And, you know, if they are, it's usually the surgeons who handle them. So you'll notice that my medical history, most of my patients, it's really not something that I take into concern. Not saying it's not important, but it's not something that affects our work. So like I was saying, challenges, shade matching, 10-year-old composite. This is one that I wasn't too ecstatic about at the end, but you'll see why. And reassessing material selection to give long-term stability. You know, in composite or resin, whichever term you guys use, there are different types. You know, there's microhybrids, there's nanofills, there are microfills, all have properties that are beneficial depending on where they're used. So material selection is very important. You know, if you need strength, you may go with a hybrid. If you need, you know, polishability, then you go with a microfill. Just so it's important to know what you're using and where you're going to use it. And there's also tints and opacers and so on and so forth that comes into play, which kind of help us enhance a patient's smile by giving the natural appearance, because you're able to use the tints and opacers in a way to recreate, I guess, natural beauty. So here's a second case. Patient came in. I believe this patient was a mixture of crowns and composite bonding. She came in and she had broken off number 10. And she came in and she was like, I have an event, I need this fixed now. So I was like, okay. So I look back in her notes. This was done, I want to say 12 years ago or something. So I was like, okay, you know, let's get it done. I made the mistake of using the shade that was used 12 years ago. And as you can see, the value did not match up, unfortunately. It's a little bright, but like the overall contour shape matched really well. She was happy, but, you know, coming from a cosmetic point of view, I was like, we could have brought down that shade a little bit, maybe reduce the value so it wasn't as bright. But at the end of the day, she was okay with it. And she was able to carry on with the rest of her weekend or week, I don't remember when it was, without a broken tooth, which is very important. So this is actually a case I'm working on right now. And, you know, for anyone who follows me on Instagram, you'll see the before and after posted, hopefully within the next few weeks. Patient comes in, chief complaint, my daughter is getting married in 3 months. I want to fix my smile. There's multiple things that drive patients to want to get rehab or fix their smile. You know, weddings and big family events are one of them. Once again, medical history was non-contributory. I believe maybe some blood pressure issues, but definitely something we can manage fairly straightforward. Challenges that come into full mouth rehab cases, stuff that, you know, I personally didn't touch on enough in dental school, and I can't speak for everyone because it's a little different. you have to look into their joint health. Their joints are very important when it comes to doing full mouth rehab, because you can put together, I personally, if anybody can put crowns in a mouth, you can put 28 crowns and boom, you have crowns in a mouth. But if you don't assess joint health and you're not looking at their occlusion, you could put them in a traumatic occlusion, their bite. It could be traumatic and it can lead to healthy joints to break down. So that's something you got to take into consideration. You got to diagnose any parafunctional habits, grinding, wear. You got to look at where it's coming from, what may be causing it. So there's a lot of diagnosing and initial workup that goes into creating these beautiful natural smiles, right? If they have these habits, you got to think about what kind of material am I going to use? What's going to hold up the longest? What's going to hold up the best? If you're doing it against natural tooth structure, you have to know what material you're going to use against natural tooth structure, because there's some material that's going to break down natural tooth structure over time. You got to know, how you're going to pivot if you're taking off some crowns and you realize this tooth is non-restorable. I ran into that issue as well. Finishing the case in a timely manner, right? Everyone wants to get in and get it done. You got to set the expectation, right? It's, hey, it didn't take one night for your mouth to break down. It's not going to take me one day to put it back together. Granted, you don't want to work on a case for a single part of a case for 6 months, unless, it's a multi-specialty approach. But depending on what they need, you want to be efficient. And understanding the patient's expectations, setting them properly, and understanding their vision, right? There's a lot of like I said, a lot of pre-workup stuff that goes into creating a beautiful rehab case. So, and I can show that I don't have it here, but I can screen share it and I can show you guys at the end if you guys would like to see, trial smiles, seeing a patient's face, taking the right photos, and, recreating a smile that fits their face. I personally don't believe in a cookie cutter approach when it comes to doing full mouth rehab. I don't think one shape matches everyone's face. There's multiple shapes in terms of teeth. You can have an aggressive smile. You can have a soft smile. There's a lot. So, understand their vision, work with them, collaborate with them, and achieve results that you both are happy with. So here is the case I'm currently working on. Patient came in, like I said, wants to have a nice upper smile. He's like, the lower doesn't bother me, even though we can see that there's some breakdown. It wasn't as bad as the upper, but there is some breakdown on the lower, which we will be fixing. But he's like, I don't show my lower. I smile with my upper teeth and I want to fix them. So for this case, I took all my records that I needed, the photos, the models, assessed his joint health, checked his bite. And I kind of worked up the case to see, what would look good, what I need to do to achieve that. If you look on that picture on the upper right, where I'm showing those upper anterior teeth, I saw the chipping along those incisors or along the edge of those front teeth. And that made me worry, is there something going on? Is he grinding? So what I saw was he had a very tight bite. So you have to release that somehow or manage it, with night guard or whatever you're going to do to manage it. So this was a little tougher case. I also ran into the problem that I mentioned earlier. The back of his upper teeth, the area is all crowns. The fronts, it was all natural tooth structure pretty much, a couple cavities here and there, and the back are crowns. So I didn't know what was underneath those. So when I took them off, there was quite a bit of decay. So it took a little bit longer to get through the case than I thought I needed in terms of time, a lot of time. But that's some challenges you may run into. So something I would recommend for a case like this is sometimes it's better to break them down into multiple appointments as opposed to, setting yourself up for almost like a marathon where you're sitting for 9-10 hours working on a single case. So I will open it up to any questions that anyone may have. I can actually let me show you a couple photos of what I mean in terms of showing a patient a trial smile so they can see it prior to doing the case. Let me see if I can pull that up. Give me 1 second. Yeah. So when we match shade, we use polarized filters to kind of get true value of the tooth shade. Plus we use natural lighting because we have a lot of windows in the office. So we open up the blinds and we check it under multiple different lighting environments to kind of see what is going to give us the best result. We also sometimes just take composite, we put it on the tooth we're working on, and we use, like I said, the polarized filters, and we take multiple photos to see if the composite we're using is going to blend well with the tooth next to it. Does that kind of answer your question? Yeah, and then, okay. Yeah, composite blending and matching shades, it can be very, very tough. All right, so here is, quickly I'll share this before I jump into the questions again. So you can see this is a patient of mine that I'm working on where we did a trial smile. I took her models and I mocked up what a new smile would look like for her. And then we transferred over using a PVS putty guide and just using, you know, a bisacryl material and just overlaying it on top of her teeth to kind of get an assessment of, you know, if we were to create this smile using this shape, how would it look in her mouth? And this one turned out really nice. So, you know, we have an idea, patient understands what she will be, what potentially she can get when everything is said and done. So this is a very, very important tool for us when recreating or doing full mouth rehab, because it's almost like test driving a car, right? Imagine doing all this work, you think it looks beautiful and the patient absolutely hates it. All right, so we can hop on and we can talk about questions now.
Okay, so back to the Q&A. It says, is there any type of medical history that can be contributory to the general type of cases that you see?
So let's see, medical history wise, you know, I can see things like bleeding issues, you know, people on warfarin and stuff like that, getting in the way when we're doing preps or when we're packing cord and you can't get proper hemostasis. That can get in the way in terms of impressions and stuff like that. If the medical history includes something that has developmental issues in terms of the enamel or the dentin on the tooth, that can be something I can think of would get in the way because that would affect material selection, right? If we're doing veneers, you need a lot of enamel because you want good bonding. But if you're primarily in dentin, it might be better to consider doing full coverage, stuff like that. That's what I can think of off the top of my head that would be a medical issue that you would have to think about and consider. So developmental disorders like that, like I said, warfarin, bleeding issues. I think more so it's the surgical aspect that medical histories matter more, because when you're doing surgeries, it involves a lot more healing.
Okay, so the next question says, if someone had unmanaged high blood pressure, how would that change your treatment plan?
So unmanaged high blood pressure, right? I think this is a fairly common issue that most dentists run into, because you're gonna come across patients multiple times in your time where, number one, they don't know they have unmanaged high blood pressure, or you know, even though they're taking medication, it's not the right dosage. So you just have to get a baseline for their blood pressure, and when you assess it, you have to tell them, be like, hey, you're a little uncontrolled. How it affects what I do is it comes down to the dental anesthetic, right? It's understanding how much you can give them and monitoring their blood pressure so it's not going through the roof. I personally refuse to work on people who have uncontrolled high blood pressure. I just I'm not taking the risk. It's not worth my time, nor do I want to take on the liability. So I tell them, get it under control, and then we're more than happy to proceed. So that's how I would approach it. Because even with people who have controlled blood pressure, you have to take into consideration what kind of beta blockers are on, whether it's selective or non-selective, and approach it after knowing what medications are on. So that's how I do it.
Okay. Can an overbite and underbite be fixed with any cosmetic rehab procedures?
So yes and no. So depending on, overbites and underbites, cross bites, there is an extent to how far you can correct those type of bites using restorative procedure. You can jump some cross bites and you can fix minor, underbites and overbite issues, but it does require you to flare some teeth out, push some teeth back. It may require more aggressive preparation. So the answer is yes, it's a case-by-case basis. Too severe, I wouldn't recommend it. If you have a severe skeletal issue, then you got to tell them, be like, if you're off by multiple millimeters, where it's like 4, 5, 6, you may not get an ideal aesthetic outcome, nor will it work. Because when you try to fix something that severe, even if you put them in a night guard, sometimes their jaw wants to go back in that position that it was in, and it may break down whatever restorative procedures you've done on those teeth. So there is a limit to what you can do, but yes, you can. You just have to do it case-by-case basis.
Okay, the next comment says, I believe you brought up occlusion for case number 3. Can you explain a bit more on what occlusion is?
So my idea of occlusion when I came out of dental school was how people bite, right? Plain, simple, nitty gritty. But occlusion is so much more complex than that. Occlusion is how your jaws fit together and how your teeth fit together, and how all of that interacts with your joints. So when I look at occlusion, I don't look at just, the person's biting and they're biting well, great. Like I was saying earlier, I check their bite and I check their joints. You want to try to seat the position, whether it's through bimanual manipulation, using a leaf gauge, using an NTI to deprogram them. You do the best you can to check where their bite is, their MIP, which is where their teeth come together, and their fully seated position, which is where the condyles are in their most superior anterior position, which is the most stable position for the jaw to be in. And hopefully there's not a significant discrepancy between that, because even though you can restore an MIP, they may be breaking down your dentistry, because at night, if their jaw relaxes and they have interferences, they could be hitting on a single tooth, and you notice, hey, the second molar keeps breaking. The dentistry looks beautiful, but why does the second molar keep breaking? It's because there's a discrepancy in their occlusion. So that's what I mean by occlusion when I say assess it, assess everything, check if there's wear, see if there's chipping, why is there chipping, if there's erosion and stuff like that. All these issues need to be looked at prior to you doing the dentistry, because you don't want to do beautiful work and your patient's coming back every few months like, this broke, that broke, this broke, this debonded, this came off, why does it keep breaking? It's a headache for you, it's a hassle for the patient. At the end of the day, no one's happy. So I hope that kind of answers what I mean by what is occlusion.
The next comment says, how do you deal with stress / work-life balance?
Poorly. No. I tend to stay very busy between my residency, working a part-time job, and trying to balance, my social life. There are days where I work 6 days a week and not much of a social life on those weeks. There's days where I work 5 days and I try to get out on the weekends, whether it's, like I said, go explore new restaurants, go hang out outside, take in the weather. I try to be active as much as I can, work out 3 to 4 times a week. When I get time, I try to play video games. I don't know if anyone who's watching plays Warzone, but Warzone is a great way for me to decompress. But that's what I can do right now. I do grind a lot, and But like I said initially, you can't burn out, because if you're always go, it can get tough, and I don't want to ever burn out. I still got a long way to go. So that's how I try to balance everything out. I have to make time for things. I know I have to make time for things. So you just have to prioritize and do what you need to do to kind of include everyone in your life and give everyone the attention they deserve. So give your career attention, give your relationships attention, and decompress and give yourself some time too.
Next comment says, can you tell us a bit about one of your toughest cases / patient?
My toughest patient slash cases. Trying to think. I would say, so my toughest case ever wasn't a cosmetic rehab case. It was actually a surgery case that I did a year and a half ago. I did not assess the radiographs as well as I should have, and it was a full mouth extraction case. And what happened was I had booked out 3.5 hours, I believe, which is fairly typical for me to do a full mouth extraction, place immediate denture, so on and so forth. I get in there and it took me 3.5 hours just to take the upper teeth out. And these teeth were just not moving. It was like they were in cement. And so that was probably the toughest case. I remember, because I started the upper, I finished it, and I tried to approach the lowers and everything just kept snapping. It was stressful. It was not fun. I actually had to drive the patient to another office. I personally got the patient in my car, drove him to another office, and another doctor took over the case. And after everything was said and done, he's like, this probably should have been an OS case. But you live and you learn, and no irreversible damage was done. But it was a lesson learned.
A next question says, how do you get new patients?
So new patients, for me right now, being a resident, my preceptor or my mentor who's at the office, he kind of supplies me my patients. And I reach out to a bunch of my friends who, may be looking for cosmetic work, or even who need basic dentistry, just because, to hone in on my skills and just start working, and even doing workups of cases that may not need much. So I just have my friends come in, or my mentor will give me cases like, these emergencies that come in and stuff like that. But that's my main source right now. I am trying to get more onto social media, because, social media is very important nowadays in marketing yourself. So I think as I change my focus more onto social media and start posting more, I'm hoping that will be one of the avenues that'll bring more patients towards me. In addition to that, you got to network with your local specialist. A lot of specialists are, they're looking for good GPs to refer to as well, right? People come into, one thing I didn't know is people actually go to specialist offices without referrals, which I didn't know that was a thing. And it's something I learned recently. They can look a specialist up and be like, hey, I need this, can I come in? And the specialist will see them. So it's just networking and getting your name out there, letting people see what you're capable of doing. And then, the traffic starts to come. Plus, word of mouth is very important. So whatever you do, I firmly believe this, whatever you do it really well, do it to the best of your ability, and, treat people right. And you won't have empty chairs.
Okay, and our last question is, what's your favorite procedure to do? And a follow-up would be, what's your favorite tooth?
So my favorite procedure to do would be, like I said, I really do enjoy surgery as much as I enjoy my cosmetic dentistry. So I would say probably extractions, and my favorite tooth has to be, I'd say number 8, central incisor, front and center, central dominance, right? In the spotlight.
Okay, one more.
Yeah.
From your experience, do you think dental school prepares individuals enough to practice general dentistry?
Okay, so yes and no. dental school will teach you enough to make you an efficient enough clinician to do basic dentistry, I believe. And that's from my personal experience. You know, I haven't been to every single dental school out in the nation, so I don't know how everyone gets trained or prepared. But I learned a good amount, enough to come out and be able to perform dentistry. Was it at the level that I wanted to do it at? Definitely not, because I realized early on in my career that I want to do high-end cosmetic stuff. I want to do it well, and I want it to look nice. Like I said earlier, I want it to look, you know, like I didn't even touch the teeth. So that is not stuff that I learned in dental school. So I had to kind of reach out, network, and, you know, build a network to learn what I wanted to learn. There's a bunch of CE out there that people can do. And I know people who go through these curriculums of, you know, Spear, Coyce, Dawson, and they're all great. But I'm the type of learner that is, you know, if you go do a course for a weekend and then you come back and then you try to, you know, perform these procedures, what if you run into some trouble? You know, they may have taught you how to troubleshoot, but it's always nice to have someone who really knows what they're doing there to kind of be like, okay, that's fine. No, this is how we fix it. So I believe in submerging yourself in the type of dentistry you want to do, and being around mentors who can help you kind of get to that next level. Mentorship is invaluable. Everyone should find a mentor. Everyone needs a mentor after dentistry, because, you know, dentistry is hard. You know, it's not easy. It's tough. So to go back to the question, yes, it prepares you to do dentistry. Does it prepare you to do the dentistry you want to do? That varies. That depends on what type of dentistry you want to do.
All right, and that is the end of our session. Thank you, Dr. Patel, for taking your time to talk to us about your experience. We truly appreciate it, and we learned a lot from your presentation. To our viewers, we'd like to remind you that we will have a quiz today that will stay up for 24 hours. You can find the link in our Instagram bio. To Dr. Patel again, I want to thank you for taking the time to talk to us today, and thank you, everyone. Have a great day.
Thank you, guys. And if anyone wants to ask me any further questions, they can always reach out to me at officialsmiledoc on my Instagram. And I believe you guys have posted that on your page as well, right?
Yes.
Perfect. Thank you, guys.